I'm Brian Bergstein. I'm the Deputy Opinion Editor of the Boston Globe, and welcome to today's event on the future of food. Very glad that you could spend your lunchtime with us, or perhaps it's a late breakfast if you're on the West Coast, but wherever you are, happy to be with us, happy to have you with us. As you may know, this event, this panel, grew out of a special issue of the Boston Globe's Ideas section this past week, where we looked at how our food system can be better, to put it simply. So when we first came up with this idea, it was actually before the pandemic, and we were aware of how big trends in society, whether it's climate change adaptation, technological advancement, the drive to do something about inequality and food insecurity in our country, all these trends were driving a big reconsideration of what we eat, where it comes from, how we get it, and so on. Then came the pandemic, and it showed just how big some of the problems are in the food system, and it exacerbated ones that had been there for a long time. So today, what we want to talk about is what we can do to have a better food system in light of what we've learned these past few months, and how all of us in our daily lives and at the political level in our governments, how we can drive a better and more equitable food system. So first, before we get into it, I'm going to turn it over to our sponsor, Paul Salou, the CEO of Little Leaf Farms.
So Brian, thank you, and welcome to all the panelists today. Really looking forward to this, and thank you also, Brian, to the Boston Globe and your staff for initiating the Future of Food. Features so many different voices and approaches to this important issue. A little bit about my background. I'm a New England farm boy, raised in Connecticut on my family's farm, Pride's Corner Farms, the largest ag employer in the state of Connecticut. Started backyard farms, 42-acre tomato greenhouse in Madison, Maine, back in 2005, and then started Little Leaf in 2015, 16. So I've been firsthand involved with building out large-scale, at-scale facilities that are really helping move the needle so that we can take the 90% of the food that we are importing and lower that and build a more resilient and locally grown food business here in New England. The pandemic revealed the negative consequences of our dependence on global food. Everyone remembers back in late March, April, those empty shelves at the grocery store. So as I mentioned, 90% of the food that we bring in to New England, to Massachusetts, is grown outside the region. So I think there's a great opportunity to become a more resilient community by growing more locally, like what we're doing at Little Leaf Farms. We've created an amazingly, sophisticated year-round operation growing leafy greens. And one of the great things is that we've gotten the response in the marketplace where we're the #1 selling packaged salad now in New England. So we've been able to go up against the Salinas, California lettuce giants and deliver a better product, and then and at the same time grow the local food movement, which we're part of along with everyone else. And our panelists are going to talk about that today. The future of food is looked at in many different ways, innovative approaches to making healthy food more accessible, from rural to urban households, to high income to low income families. We all need to find a way to really make this grow here in Massachusetts and New England. So the way we grow lettuce is just one way. We're part of this, we think, a big tent, CSAs, cranberries, the Pioneer Valley, Aroostook County potatoes. There's a lot of ways we can grow this local food movement in New England, and we're proud to be part of it. So having said that, I'm really looking forward to listening to the panelists today. Really appreciate the opportunity to contribute our voice and be part of this ongoing conversation in this movement. So thank you very much.
Thank you, Paul. Thanks for your support. So let's get into it. I'm going to introduce the panelists joining me today. We'll go in alphabetical order for no other reason. So that means we're going to start and introduce Frances Moore-Lepay, who is there's so many ways to describe you, Frances. You're a researcher and author, a food activist, a democracy activist. Frances is the author of 19 books, about food, what we eat, how it all connects to the world we live in. And her first book, Diet for a Small Planet, was published in 1971. She's working on a 50th anniversary edition. Really grateful to have Frances join us. And I hope, by the way, if you did not yet read the food issue of Ideas, you can check out Frances's piece, which is headlined "To Fix Our Food System, Fix Our Democracy." Next up, we have Janelle Nanos, who is a colleague of mine at the Globe, though she's on the news side while I'm in Opinion. But Janelle is a great reporter, long history as an investigative reporter. Currently, she covers retail, restaurants, consumer culture. But she's also worked at Boston Magazine and New York Magazine, and knows a lot about a lot of things, and has thought a lot about how restaurants and fit into what we're talking about today. Wrote a piece as well about how pandemics typically change restaurants and how this pandemic might change restaurants from here on out. So please read that if you haven't seen that in the food issue. And next, I want to introduce Josh Troutwine, who is the founder of About Fresh, which is a local food nonprofit that works to essentially get food into healthy food into neighborhoods that are lacking in the supply. And he's also doing really interesting work to connect food with healthcare. And he'll tell you more about that. So first of all, thank you all three for being here. And to those of you in the audience, we've got a lot of great questions from you from when you signed up. All of us on this panel have been aware of some of the big themes in the questions, and we're going to try to address as many of them as we can. And then also you have the opportunity to ask questions live using the Q&A function. And we'll be getting a chance later on to take on some of those as well. So Frances, if I could start with you, and then Josh and Janelle just join in. You've been thinking about the food system and its shortcomings for a very long time. Then came the pandemic, as if to drive home what you've been talking about and working to change for such a long time. So what do you think we've all learned about the shortcomings of the food system, in the last few months, and what does it mean for our chances to finally do more to address it? And you're muted.
Thank you.
Yeah.
Yes, a hunger in the world, that was my big wake up when I was 26. Why is there hunger amidst plenty? And it is so much truer today. It is so much truer today. In the United States, we produce more calories per person than virtually any other country in the world. And yet, I just learned that childhood food insecurity is at unprecedented levels, that 28% of households with children have food insecurity. So I think the metaphor I like to use is that sometimes in a big storm, the tree will fall and you can see its roots for the first time. And so I think that this falling tree that has, even before the COVID hit us, we were faced with this extreme inequality in this country where the top, since I wrote my book way back when, the top 1% has been increasing its incomes 100 times faster than the bottom 90%. So extreme inequality and a broken democracy because of the influence of that private wealth. And now we're facing the pandemic and the intensified hunger that brings. So it is that storm that maybe we can now go to the roots. And I really like to focus on solutions despite my big negative zingers. So that's what I hope I can really open my heart to more and more. Like, we know how to do this. The solutions are there, and that food, this is now the byword in a lot of the world discussion, that food and agriculture offer us a way to address both the hunger crisis, the poor health from eating bad diets, and the climate crisis, because it is such a great way to remake our relationship with the earth so that it stores carbon instead of being a carbon culprit.
Josh, you work directly at this at solving this problem, right? Trying to address food insecurity. Tell us a little bit more about what you do, why you started it, and how things have been over the last few months with About Fresh.
Yeah, sure. So, I mean, we're focused on advancing health equity within our food system. And, I think Francis has done a great job helping expose the global, really macroeconomic context for why our food system is broken. And, we're attempting to address the realities and the consequences of that broken food system day to day and what they mean for all of our families. Strategically, we're really focusing on partnering with health systems to address food insecurity across Boston communities. So we have a mobile market program called Fresh Truck that operates across Boston neighborhoods to bring food into low-income communities that otherwise don't have access to affordable, healthy food options. As a result of COVID, we developed a brand new direct-to-doorstep delivery program to get food directly to the households at highest risk, recognizing that there is now this brand new constraint within our food system that people can't actually leave their houses to go get food. So that program is 3 months old. And then I think the program which actually holds the most promise just in terms of its ability to scale and really impact all the households we serve is called Fresh Connect. And that is a prepaid debit card and analytic platform that enables our health systems to cover the cost of healthy food for families. And I think what we've recognized over the course of the 7 years, developing all of our programs, originally starting with Fresh Truck, operating under the thesis that if we just brought food closer to communities, we can meaningfully impact healthy food consumption and health outcomes in our communities. That was wrong, right? And we really recognized pretty early on into developing Fresh Truck that we needed to also address affordability as a barrier towards healthy eating. But when we think about at least our framework for equity, the reason why people don't have enough money to afford the food that they need to be healthy, right, is simply just a consequence of, I think, policy, oppressive policy systems and structures that prohibit people from, attaining a living wage that allows them to afford the food that their family needs to be healthy. And so we're really excited about the potential of Fresh Connect. And, we do important work every single day, but I think it's important that we zoom out and look at the systems that require our programs to have to exist in the first place.
So you're literally packing buses full of food and driving them into certain neighborhoods, right?
Yes. Yeah, we are. So they're retrofitted school buses. It's a pretty typical retail operation, except that it happens inside of a school bus. So you're walking on, you're grabbing a basket, you're doing all your shopping. We carry all of your fresh fruits and vegetables and staples that you'd find in your grocery store. You pay before you step off the back of the truck, and then you're on your way. So we're just like a local grocer across our communities that don't otherwise have affordable, healthy food. We had to make a few modifications because of COVID. We've actually brought our entire operation outdoors. We're now offering pre-packed bags of groceries to cut down on the transaction time and to just enable some physical distancing between our shoppers and then between our shoppers and our staff to make sure that everybody's safe. But yeah, it's pretty much just that straightforward, just bringing food to the people.
Janelle, why is a model like that necessary? How did we get to that point, right? We have so much food in this country. So much of it is wasted, but why is it that there are just, there are so many places that it's just not, the food is not reaching without an intervention like what Josh talked about?
I mean, we look at the city right now that's up until recently been going through a development boom. And I'd say that development is still very much underway, right? You see all these tall towers in the seaport, and guess what? There's still not a supermarket in the heart of the seaport. Trader Joe's finally opened in Fort Point, but some would say, deep into the seaport, it's still not really there. And even that, is Trader Joe's the most serviceable or affordable option for people? It's not clear. So, when we think about development and how our city has been growing, food is not always top of mind, and accessible food, I guess, is the point. There's a lot of development and real estate that's going up that wants a great, beautiful, farm to table restaurant on its ground floor. But whether there's going to put in a serviceable marketplace for people is not always the highest priority. And so, the idea that, part of why Josh started his company and going back and rereading some of the materials about your organization, it was when, a supermarket closed in the neighborhood where he'd been working in health, with health policy. They were going to shut down for a year for a redevelopment project, and there was not going to be a place for local people to buy their food. And that's just a problem. So, I mean, I think there's also just bigger picture looks at things where, you know, we look at the affordability of food and the benefit programs and the policies that Josh was talking about too. And, you know, they're not sustainable in a way that can help people grow and thrive. A lot of this is making people's ends meet, right? As opposed to helping people get ahead. And I think, you know, as Francis sort of said at the very outset, like, we knew there was a crisis in our midst in terms of inequality, and we knew that a lot of people were hanging on by a thread in terms of their ability to survive and feed their families. And when something like a pandemic strikes, it just laid everything bare, and it laid everything to waste at the same time. I mean, you have people who are, you know, the people who are disproportionately impacted by COVID are also the ones on the front lines and are also the ones being paid the lowest salaries. When you think of the people who are in our supermarkets every day, the people who are in the kitchens of the restaurants every day, those are some of the hardest hit workers in this crisis. And, you know, affordability and food access has always been a struggle for them, and it's just that much harder now.
Some of the things that the pandemic showed were around the food supply chains. So we had people showing up relatively early on in the crisis. People started to show up in long lines at food banks and food pantries. And yet farmers and food distributors, cut off from their normal customers in restaurants, were dumping milk down the drain, slaughtering animals that they no longer had a market for. We've seen that, as Janelle just alluded, people with the worst outcomes during COVID-19 are often communities that have some of the lowest food access. So nutrition and this pandemic are really closely intertwined. And then you also, as you also alluded, Janelle, the food system is also, the question of wages for the people who work in the food system itself has come up. So by some estimates, I think as many as 1 in 7 or 1 in 8 people in this country work somehow in food service, whether it's in production or in restaurants, whatever. And we saw what happened where the system, as it's been constructed, to keep it going, meatpacking workers were forced back to work in unsafe conditions that created these COVID hotspots. So, long way of saying that we saw all these long-running problems sort of explode. And as you mentioned, Francis, that's often a time when people say, okay, we can really now see the problem more fully and do something about it. But what we've all just been talking about is extraordinarily complex and intertwined. So how do we begin, you know, to build something that is actually more like the food system we would actually want if we could design it from scratch? Where to begin?
You want me to jump in?
I think Francis is the voice I want to hear on this first, for sure.
Well, so many things I want to say. Just about the cost. I just read that if we had a healthy diet in America, that our healthcare costs would be $50 billion saved, minus $50 billion from just eating healthier. So we know the solutions. And I think what's so hard for us is that us meaning Americans, that we don't have a way to talk about solutions that use words that can bring us together. For example, we talk about, you know, what other countries have done, for example, to support non-pesticide agriculture, actually supporting the regenerative farming without dangerous chemicals. And that's a government initiative, say in Austria or in India, and in one of the biggest states in India, where they reduced pesticide use by half in just 6 years. So what's the language to get our heads around it? And I like to use the language of economic democracy, because Americans were for democracy, but we see that we're losing it because we don't have a concept of economic democracy. The tiny 1% of us contribute 71% of political contributions. Lobbying leapt 14-fold in numbers of firms lobbying after around 1980. I mean, the concentration of private power over our political system. So I think if we can name that, it begins to open up all sorts of possibilities to rethink what we could do with that money. And so the word socialism can scare the bejeebies out of people, but democracy is what we're really talking about. And that's what's been compromised by the power of wealth over our political decision making. And I was just thinking as Josh was talking, imagine if we had a government that was hit with this pandemic and said, oh, well, of course, one of the things we want to do is allow every vacant lot everywhere in America to start growing food. I just read that in Detroit, there's something like 17% of the land is vacant. So our imagination, we have examples of what works. And I think the American people can really embrace it if we offer very practical ideas and talk about it in terms of greater democracy. And really standing up for that principle of one person, one vote, and that money doesn't drive politics, because we've been warned and warned and warned. In my piece on Sunday, I quoted FDR, who said, "The liberty of democracy is not safe if the people tolerate the growth of private power to the point that it is stronger than the democratic state itself." That, in its essence, is fascism. Now, I like to joke, I don't use the F word without quoting an American president, but I think he nailed it. And so, but we need a new language because we can't use that word. And for me, the positive is, and what Josh is living, is this idea that we are entrepreneurial people. There are solutions. They can come from the bottom, and they are commonsensical, and they bring us together, which is what democracy is all about. I'll just stop on this rant with our preamble to our Constitution says that our purpose as a nation is to, quote, promote the general welfare, right? How are we going to do it? And that's what we're talking about. We're doing what our Constitution claims, has stated is our purpose as a people.
Yeah, Brian, I would just add to that I think for so many of us, for whom grocery shopping is a chore, or for whom, you click a button and get a box on your doorstep and you don't really think about your purchase habits when it comes to your food consumption, the pandemic has forced us all to reconsider that and recalibrate the purchases that we make and the thought process that goes into it. And I think that's the start. I mean, I think, just as America is having a reckoning when it comes to its racial history right now, and many people are taking steps to reevaluate and reassess the way that they deal with, handle and think about racism, I think, I don't mean to equate things by any means, but I think that there's a reckoning of sorts that's happening on so many fronts. And that, when it comes to food systems, we have to be open to that to a discussion as well. The idea that the choices that we make, that the decisions that we make, the purchases that we make, all have impacts. And so, it's been a really interesting to watch as a result of the Black Lives Matter movement, a real push to shop at Black-owned businesses and Black-owned restaurants, and how those purchase decisions have economic impact as well, and how the two are very much hand in hand in many ways. Giving people economic power through purchasing and supporting their businesses can help right a lot of social ills. And so these things are all tied together. And I think, there's just an opportunity here. We're all stuck at home, mostly, if we're not essential workers, to really start to evaluate the choices we make and the impact they have. And that's one hopeful thing that I see coming out of this, that we can start being more thoughtful in that regard.
Brian, if I could follow up really on that too, and a thought I had off of, I think what Francis had mentioned about the potential for cost savings, is that I think we have a concrete opportunity right now, particularly here in Massachusetts, but more broadly nationally, to recruit our healthcare sector as an investor in creating a more equitable health food system, right? Like, they have a lot of skin in the game here. As Francis mentioned, health outcomes attributed to our diet cost our health system a lot of money. And what we're seeing here in Massachusetts is a transition towards value-based models of care that are designed to compensate providers on the basis of patient health outcomes and cost savings. So they're being held accountable for the total cost of care that they deliver to their patients, as opposed to being compensated based on the volume of care that they deliver, right? Because our previous health system rewarded healthcare providers for delivering really expensive healthcare after patients were already sick, right? And we have a world-class health system. People aren't getting sick because we don't have enough doctors in hospitals. It's because people don't have stable housing and people don't have food. And so we've been really successful at engaging health systems to invest behind our programs as part of their strategy to address food as a social determinant of health in an effort to contain healthcare costs. So there's, I think, real value, to Francis's point. If we can come up with creative solutions to address food insecurity, I think there's real potential for us to recruit health systems as an investor behind those solutions, particularly here in Massachusetts, as we're one of the first states to adopt this progressive model of value-based care.
Say a little bit more, Josh, about how you went about doing that, with About Fresh. Like, how did you recruit healthcare providers here in the Boston area and get them involved in what you're doing? Was it a tough sell?
No, it wasn't. I mean, we have incredible health systems here that really care about Boston communities. I mean, we have a long history of working with Boston Medical Center and Faulkner Hospital. And it started off as a really grassroots partnership where we were working with a network of social workers and community advocates to implement the first version of our Fresh Truck programs. But within this, over the course of the last couple of years, as Massachusetts has transitioned to this value-based model of care, one example of a success that we've had in engaging health systems to develop a more institutional sort of scalable partnership is through the Massachusetts Flexible Services Program, which is a new fund that's being made available to the network of Massachusetts providers that healthcare providers that are serving low-income Medicaid patients. And it's funding that's being made available to those healthcare providers to address the social needs, the non-clinical social needs of patients. So in partnership with Brigham and Women's Hospital, we earned a $3 million contract to administer our Fresh Connect cards to those patients. So now when a patient is walking into a doctor's office and they're getting sick because they don't have the money in their bank to afford the food that they need to be healthy, Brigham Health, their ACO, can administer one of our Fresh Connect cards that they can use to go to a grocery store to buy healthy food. And then I think where we see a real opportunity in that program and the way that we've constructed the analytics system behind Fresh Connect is to actually capture all of that data, compare it to electronic health records in partnership with Brigham Health to actually measure the long-term return on investment in terms of food security status, patient healthcare, health outcomes, and then healthcare costs over time. And then we're hoping to leverage all that data to build the case that investing in healthy food can actually help us contain healthcare costs and advance health equity. So we're super excited about that solution. And like I said, that's not a grant program. Like the design of the Massachusetts Flex Spending program from Mass Health is meant to really integrate social determinants of health into the framework of our health system. And the total investment's $150 million just in that one program. And then there's a broader $1.8 billion investment in the transition of our Massachusetts healthcare infrastructure focused on addressing social determinants of health. It's a massive opportunity if we can find the right solutions.
When we're talking as well about the way multiple systems interact, it's come up a few times already in this discussion about the role of local and regional food supply, both from a economic sort of resilience point of view to an environmental sustainability point of view. But a common theme that Josh has told us about before today's call, and a lot of comments that we've gotten from readers, is whether the drive to grow more food locally is something that everybody can afford. Essentially, local food tends to be more expensive in a lot of instances. So Paul at the outset talked about what they're doing with lettuce, which is the kind of crop that makes sense to grow indoors year round in New England, but a lot of things don't. And so readers have pointed out, it's not realistic for everybody to have a home garden, or, the farm to table movement feels like a fetish, or it's expensive. And, how do all of you assess the reality of this claim that local food is inherently better? And to the extent that it is, how can we make it more accessible?
Well, I'll jump in again about just where our public dollars go. As Josh was talking, I was imagining what if the healthcare workers in America would contact their legislators and say, hey, why don't you divert some of this billions that's going to subsidize processed foods, basically, because it's corn, soy, it's going into meat and processed foods, and sugar is heavily subsidized. Shift that over into helping every community in America to have more whole and fresh, when possible, food that's affordable. I mean, I just want to keep emphasizing this, that right now we don't see the resources because they're being diverted so heavily in another direction to create diseases like diabetes, for example. So I think that certainly that the kinds of programs that Josh represents, and just having more unprocessed foods that are healthy and alternatives to the junk food that's subsidized, I think is a central piece of this. And I know, from my experience of watching what in Oakland, California, where there are many of these sorts of instances where people working in poor communities are working directly with people to in cooking together to learn how to make the very most of the high quality foods that instead of the subsidized cheaper foods. So I think there are multiple pieces of this, of course, but I just want to bring us back to how now we're diverting so much of our energy toward what's bad, and that has to be called out and stopped. And as we then redirect to how could Boston and everyone have greater access to the kinds of things that Josh is talking about.
And I think I'd add on to that by saying, like, just to answer your question very directly, like, increasing our consumption of local food is really good. It has a ton of potential to promote, greater economic justice, given that we have more visibility into the supply chain and how farm workers are being treated and compensated, and also to promote environmental sustainability. And I'll allow Francis to speak to exactly to what degree that's true within our food system. So there's a ton of benefits. And I mean, I think food also, and local food, has the inherent ability to build community, which I think is an important facet of our food system, to the extent that we need to rethink how we eat in favor of our own health, in favor of our sustainability. The reality for me as a small retailer that's trying to manage like a very sensitive pricing structure for my community of shoppers who are economically marginalized is that local food is more expensive, it's seasonal, and it's not always culturally relevant. I mean, what Paul brought up to me yesterday, and what Little Leaf has done a great job of doing, is developing really smart supply chain solutions and adopting technology that has allowed them to bring down the cost of their food, which is being grown locally, and as Paul alluded to, remain competitive in grocery stores and help me as a retailer make sense out of that pricing structure, sourcing food locally while also getting it to my families at a price that they can afford, while as an organization making sure that we are financially whole. So I'm really excited about the potential of, I think, more local growers following Paul's lead, adopting technology to make it more tenable for me as a food retailer, the specific emphasis on serving economically marginalized communities, to make it affordable for me and for my families to be able to consume, to offer and to consume more healthy food. And then I think, fresh, but the reality is local food is expensive to grow, and we need to make sure we compensate farmers. Like, we can't artificially lower the price of local food, like on the backs of our farming community. They're already hard up given all the constraints of growing food in the Northeast. So we're also really excited about the potential to just fresh connect, to put more money into people's wallets so that the true price point of local food becomes affordable, and there's not this compromise between having to like balance your food budget and like choices between whether your food's gonna be healthy and whether your food's gonna be healthy and local. So I think, there's innovative ways to play with the economics on both sides by either giving people more money or actually adopting, technology and just smart supply chain solutions to bring down the cost of the wholesale cost of food.
Yeah, I mean, just to hop on that one piece of it too, is that, food that is cheaper moves farther and expires and goes bad almost faster in some cases, right? So when you have a locally grown carrot or something of that nature, it's going to stay edible for a much longer period of time if you've gotten it sooner, quicker, nearer to your home. When you think about that, I think of the Daily Table, which is a grocery store concept in my neighborhood in Dorchester, which uses food which gets donated food in many instances from companies that for whom it's approaching an expiration date, right? And the idea is that food that might be thrown away at a grocery store because it's about to expire is donated to this and then sold at a much lower cost. And so, when we think about some of the structures that are in place that also keep food cheap, they need to be rethought and restructured from a retail perspective too. We have laws here in Massachusetts that say you can't sell expired food, which when some of it is actually perfectly good and the labeling for expired food is really kind of willy-nilly, and it's more it's not always clear that to consumers, you might think expired food on a label means it's bad, but it actually could have a shelf life of another few days or weeks, depending on the food item. So there's a lot of policy pieces that need to go into this too, from a retail side, that would also make affordability more of an option.
I just want to jump in there about the waste of our food, because we are kind of a champion in the world on that one too. 40% of our food is wasted. Worldwide, it's about a third. But I've been inspired by other countries where they have really encouraged people in sort of a teasing kind of label. They had ugly fruit, for example, campaign in France. But the point was, it was kind of a sense of humor about, hey, wait a minute, a little bit of blemish on something doesn't make it inedible at all. It can be delicious and it's fine. It feels more like it's coming out of the garden. So they make that food then more affordable and really look at the expiration date so that they're not unreasonably or too short. And so many ways we could make more food available with just adjusting that in our system, and so much less than would go to the landfill. And that's another climate bad that we could reduce. So it could all build on it in a very positive way.
This idea has come up a little bit in the last few minutes about just giving people more money. We're hearing that in a lot of ways. There's this discussion around universal basic income, which has gained momentum in the last year. During the pandemic, the stimulus checks that rolled into a lot of families, we know that made a difference. Sometimes it's possible to overthink the solution. How far could we get to really improving health outcomes, solving a lot of the problems we've just been talking about, if we simply expanded programs that are already in place, like SNAP, the program formerly known as food stamps? There's a part of the HEROES Act passed by the House, would have significantly, although temporarily, expanded the benefits under the program. It's stalled in the Senate right now, but there's a chance, there's some hope, let's say, that something like that can get taken up. Is it possible that literally by expanding programs we already have to, widen the number of people who are eligible for food subsidies and to increase the amount that people can spend every month, and to increase the places where you can spend your SNAP benefits? How much of an improvement would just that, policy target achieve?
Well, I think it would be huge, a huge piece of it. And I would also really add the minimum wage is the key, because our minimum wage and real purchasing power has continued to slide. So I would really start there. And also, we've made it harder for labor to organize. And so we know that organized labor, think about the meat the slaughterhouses, the meat packers, the pushback on, the capacity of people, given our policies toward immigrants into this country, but any way we possibly can to remove the barriers to labor organizing is, I think, a key piece of the solution here, and all the things that you're mentioning. Whereas, repeating myself here, the theme of what I'm saying is that we have the public dollars. Now they're going to the very wealthiest. That I was just looking at, the people who are getting our tax dollars via our farm subsidies. It is to the very richest farmers that's going, and hundreds of thousands of dollars a year. So I couldn't agree with you more that the tools in terms of just making de-stressing, because we know that's part of our health problem is so much stress, to just enable people to have more purchasing power. It's just so obvious that our extreme inequality, I just want to say here to everybody, because I think we know that our society has an extreme inequality, but do you know that actually our inequality here in income is worse than over 100 countries in the world? So we're not just worse than Western Europe. We are really out there compared to any other industrial country.
Yeah, Brian, I would just hop on that to say, I think obviously extending any kind of benefit to people in which they would have more purchasing power through a SNAP program or something like it would have incredible impact. I think we're seeing that in part through the unemployment benefits that have been afforded people in light of the crisis. So, the unemployment benefits have had a $600 additional add-on for the last few months. And in so many ways, one of the most surprising pieces that I've learned out of that is that in many instances, people are earning more now on unemployment than they were in their jobs, right? And so there's really no incentive for them to go back to work and put themselves at risk because many of these jobs are low paying. And now those benefits are they stand to run out at the end of this week. I know food pantries are now getting ready because they're anticipating, a huge uptick in SNAP applicants coming back and more need than ever before. It's obviously clear that having these types of programs in place are supporting people, and they're filling gaps they're filling gaps, but are they solving the real bigger problem, I guess is the question, right? Is giving somebody a SNAP benefit also giving them the opportunity to get a good paying job or to sustain their family in other ways? I don't know. And I don't know that that's the only solution by any means, but certainly giving more people, purchasing power to make those choices and to feed their families is going to be, I think a really important part of this conversation as we go forward.
Yeah. No question, SNAP returns economic, social, and value to our value to our health system, and it's critical that we continue to fund SNAP and expand enrollment at this point right now. But I think it's really important that we don't get away from the larger conversation around equity and take into consideration why programs like us and why programs like SNAP have to exist in the first place. And that work to address the fundamental systems and barriers and obstacles towards achieving the conditional state of equity for our communities that are marginalized. It's one at the policy level, it's one through advocacy. And so right now, do we need to fund SNAP? Absolutely yes, but I think it's important that we keep our eye on equity, think beyond SNAP about how we change the fundamental systems and structures that create the need for SNAP in the first place.
So when we're talking, go ahead, Frances, please.
Oh, and on this point, one of the things that's inspired me for a long time that makes so much sense that we could do it here is that we're in a crisis like this with high unemployment, that in, for example, Germany, they handle it very differently. They help employers to keep people employed instead of forcing, layoffs in downturns, and then people don't have a job and they're desperate, and all that stress and all that cost to the company to have to fire and then rehire, and have to lay off and then rehire. And so we could shift our unemployment framework from, let them be laid off and then we'll help as a public good. Rather, let's make sure as few people as possible are laid off. And that just makes so much sense. Obviously, it would have to be carefully monitored in the public interest, but I think that approach is one of the reasons that some other countries have been less damaged, because people haven't had that lost job, panic. They've been able to stay employed.
Josh, one of the questions we're getting from readers is how you actually make sure that the people who use the card to buy food are actually putting it towards healthy purchases. So, in the when healthcare providers are helping to fund the use of that card, what sort of checks are there on that system? Or is there some sort of educational component where good nutrition education is also baked into what you're doing?
Well, I'll start off by saying, like, the vast majority of our the shoppers in the communities we serve know how to eat healthy. I mean, we serve a ton of immigrants that are not even a generation removed from growing and scratch cooking their own food. So the degree to which, like, education is an important part of the formula is, like, a little bit overstated as we think about the overall scope of our programming. And then Fresh Connect is a dynamic debit card system. So health systems actually have the capacity to log into a web-based platform that we've developed and define define healthy food. They're able to sort of restrict the options that their patients have around what foods that they purchase based on that patient's dietary health profile and based on what they define as being healthy. We just transitioned to a new, we're in the process of transitioning to a new debit card infrastructure with a company called FIS, which we're really excited about, that's creating that type of infrastructure for the first time. And so I think, certainly, we're imagining into the future of Fresh Connect that we're creating an interface that supports adherence and education and clinical recommendations from providers. But sort of fundamental to the Fresh Connect system, healthcare providers are able to limit the foods that their patients are able to purchase using their Fresh Connect card once they're in a retail setting where there are some foods that obviously don't match their care plan. So yeah, there's a structure in place to limit what food patients can buy using their Fresh Connect card.
Yeah, thanks for taking up that reader question. Janelle, when we're talking a lot about literally putting food on the table and how to make sure people can meet that basic need, it might sound a little off to talk about restaurants and what's going to happen there. But, restaurants are a huge source of economic development, often a business opportunity for immigrants and for, family-run, individual proprietors. So restaurants are a really important part of not just the food system, but the local economy, and they're key for the quality of opportunity. So I think it's important to talk about, how food service, food trucks, food stalls, restaurants are going to be affected. So, in the whole sweep of what we define as a restaurant, what's going to happen, do you think?
It is a very, very tough industry right now. I mean, I am talking to restaurateurs on a daily basis, and it is not easy, and it is not going to get easier. So, you have the obvious issues of just getting a restaurant back up and running. So, unlike a retail operation where you would sell, like t-shirts or sneakers, which you would still need to source from, from your suppliers, getting a restaurant back up and running means, spending a week or so restocking your shelves and freezers, and all that is paid for, or the structures by which things are paid are very different in the restaurant industry than they are in other places. So there's a lot of money that's owed still to the suppliers on the restaurant's part that's there's not going to be a way for them to pay those back in a really long time. Rents are a big piece of this puzzle. And it really depends on the landlord right now in terms of how willing they are to work alongside as a partner with restaurant owners to make it work. I'd say, the Mass Restaurant Association said that only about 50% of their members have gotten some sort of rent relief from their landlords. And in some cases that's, hey, you can pay it to me later. Well, what is later going to look like? Restaurants are not going to be fully operational until 2021, until the end of 2021 at least. Most people are talking about an 18-month cycle here that we're looking at. So you've got the rent piece of it. You've got people, which is, the biggest and most challenging aspect of this is, like, as much as we love to eat out, like, there's a very high percentage of people for whom eating indoors at a restaurant right now is not a comfortable thing to be thinking about. And we live in Boston or New England, and guess what? It gets cold. Like, I don't care how many heaters you put on patios, like, it's going to be really challenging for folks come November or December to convince people to eat outdoors. And so as much as they're making it work right now in the best case scenario where they're doing a combo of, takeout orders and outdoor dining and a little bit of indoor dining, whether that's sustainable for the foreseeable future is a really, really big thing. And most people are getting, I was talking with Tony Moss this week, who's part of the Mass Restaurants United group, which has been advocating for policy changes and for more funding to support restaurants. And he said, this week has felt for a lot of his members like things are getting even more anxious. Like, there's just this growing sense of dread. And Mass Restaurant Association anticipates about 3,600 restaurants in the state are going to close. We're seeing it now. We've got a running tally, unfortunately, on the Boston Globe website that seems to update almost every other day at this point, with some local place that's closing down. And it's hard because there's not a great solution there. You can order a lot of takeout. You can do cocktails to go, which just was passed by Charlie Baker. But, is that going to be a big fix? I don't think so. And just to my final point here, we've bailed out a lot of various industries, right? Airlines got bailed out, restaurants have not. And that's really what these lobbyist groups here locally and nationally are pushing for at this point, because they know the impact that restaurants have on the economy and the growers and producers and distributors and workers and the various ways they also integrate into our lives. We love having them. There's been such a boom in terms of, what they make in terms of the streetscape. To have a lot of those go empty is going to be really, really hard.
Well, we're running low on time, and I want to get to a few of the questions that some more of the questions that viewers have posed. Real quick, do we have the immigration policy that we would need for a better food system?
Well, I think most of us know that we're highly dependent on immigrants to harvest our food, and it's just heartbreaking to me that we don't appreciate. I was once visiting a farm workers home in Ohio, and this woman had cancer. She was a woman with children. I think it was from the chemicals in the fields, and she just looked at me without blame. She said, "I don't understand. We bring you your food. Why don't you appreciate, or why don't you like us?" And it was just heartbreaking. And so I think this acknowledging how dependent we are and supporting families like hers to ensure that they are protected from abuse and from farm chemicals and paid decently, that is the minimum. And so our whole immigration policy, I think, is just I think would really break the heart of most people if they really knew the kind of thing that we are demanding of people with no gratitude or virtually none. So yes, I think that is an essential piece of the puzzle that has to be corrected.
And I would just
yeah, go ahead.
Oh, I would just also add that when we think about restaurants as an industry, they are incredibly reliant on undocumented workers as part of their systems, and those undocumented workers are also not getting the unemployment benefits that the country is giving out to people who are furloughed or laid off right now, and so they're being hit particularly hard now in this instance as well. So yes, a lot of work needs to be done on immigration policy.
Yeah, it's a huge question. I mean, a huge issue and a big question. But like, no doubt, our food system exploits immigrant labor to artificially lower the cost of food, and that's one of the main areas of the food system that we need to address in a much larger conversation about immigration. But it goes without saying that our current immigration policy allows us to exploit labor to artificially lower the cost of food.
So final thoughts from any of you? Anything that you wish that you could have covered that we didn't get a chance to get to? We're unfortunately almost out of time.
Well, I just like to mention something that's very exciting to me, and that is that there is now a Green New Deal movement that is definitely centered in everything we're talking about today. And U.S. Farmers and Ranchers for a Green New Deal is pushing forward so many of the things we've been talking about today under this larger umbrella of the Green New Deal. And well, part of the pushback, as we know, is people will say, how do we pay for this Green New Deal? The kinds of initiatives that we're talking about. And I was just struck recently by, I guess it was Bernie Sanders who pointed out that, wait a minute, the Trump administration has cut the IRS if we just collected the taxes that are due us. And that would make a huge difference. And also I noticed research I did recently that there are 60 huge US corporations that paid zero taxes last year. So I just want to underscore that this Green New Deal, I think if it's explained and brought forward by groups like the U.S. Farmers and Ranchers and Farmers for a Green New Deal, that it could be embraced as not some elitist thing, but very much a solution that could help all of the needs that we're talking about right now.
Okay, well, I could keep talking about this for a long time. I've learned in working on the food issue of ideas that basically there's no end to different ideas, and
That's a
big
great
question about food. But thank you all. We're going to turn it back over to Paul and our sponsor, Little Leaf. But for all of you who joined us today, thank you for watching, and I'll leave it to Paul to close it out.
Well, what a really fascinating discussion it really was. Josh, you have a new supplier, so we need to get together. Yeah, in addition, being part of the local food economy, not only are we selling, all the grocery stores and many restaurants, less of them now with so many of them closed, unfortunately, as Janelle spoke about. But I want to shout out the Greater Boston Food Bank. They do unbelievable work. We've been a supplier of them from day one. Daily Table, Doug Rao, friend. We've been a supplier to his operation from day one, and Loaves and Fishes. So, I think part of being in the local food community is supporting your community, and rest assured, the product that we give the Daily Table, it's absolutely the freshest, and there's plenty of time left because it's grown 40 miles away out here at our greenhouse in Devens, Massachusetts. So once again, Brian, Boston Globe, thanks for doing this. Really, really important topic, great panel, and we're so proud to play a small part. Thank you very much.